total joint class. My name is Tracy. My position here at the hospital is Nurse Navigator. I am a contact person for you. Any questions that you have before you come in the hospital, while you're here in the hospital, after your hospital stay, you can call me. Many of you have gotten this packet in the mail, and on here is my email address and my phone number. Another place that you can find my email and phone number is if you have a patient manual, and that would be on the front of the patient manual and in the patient manual. I am usually here Monday through Friday, so feel free to call me during the week. If you want to call me on the weekend, that's fine, but just know that I'm not going to call you back until Monday. If you call me after hours, again, I will call you back the next day. I've been here at the hospital for 18 years. I'm an RN. I've worked in orthopedics the whole time I've been here, and I was a floor nurse for 9 of those years. So I took care of patients just like yourselves. And recently with the COVID virus, I went back to floor nursing. So I was a recent floor nurse. So feel free to call me with any questions. The only things I don't know much about are insurance questions. So if you have a question to ask your insurance company, call the insurance company. They will know much more than myself. And if you're not feeling well, or if you have a question whether you should go on and have your surgery, let's say you went to the dentist and you have an infection, that would be for you to call the surgeon's office. But certainly you can call me and I will be glad to help you out with that. This is going to be a 2-hour class. It's really been only lasting probably about an hour and a half. If everyone could save their questions until the end, that would be really good. Something that you might want to do is you're going to want to cover your microphone, or click on the microphone so that we can't hear your background noise, and your camera. You're going to want to not have your camera working because you don't want everyone to see you. Okay, so those couple of things would be a great idea. If you could save your questions till the end. At the end, there's a chat box at the top, and it looks like a square with some lines. You can click on that, and then down at the bottom you can actually type in your questions. So we will go over any questions that you have at the end of this program. I am going to go back and forth with a PowerPoint presentation and coming to present to you when there's times that you need to see what I'm doing. So the first thing is that packet of papers that you received, either from your peak appointment or you would have received it in an email from me. The first thing is a welcome letter from myself welcoming you to Total Joint Class. And again, my phone number and my email address is on the front. And then the next paper that you should have in the packet, that might be on the back of the front paper, is a letter. You are going to have your surgery, obviously by your surgeon, but your aftercare is going to be a medical doctor from the hospital, which is called a hospitalist, physical therapy, a physician assistant that works with your surgeon. You may not see your surgeon right after the surgery. Most patients are going home either the day of surgery or the day after surgery. And so your surgeon will be doing office hours during that time, so your aftercare will be a discharge team that'll take care of you. So in the hospital, a medical doctor is called a hospitalist. So this is just a letter from one of our hospitalists explaining their role in your care. It also talks about a peak appointment. Some of you have already had a peak appointment, and some of you will have a peak appointment in the future. It's APRNs that run the peak clinic, and they will be going over your medical history, looking over your medications, and most of the time doing your physical exam. So it would be your pre-op physical before you come in for surgery. Okay, so that's just an explanation of what they do. The next page that you have in your group of papers is going to be the PowerPoint presentation. So that's what I'm going to be going over, and we're going to start that now. So I'm going to share that screen with you. Okay. And that's just loading, so that'll take a second. Okay, the objectives of this class are, I'm going to teach you what to expect before, during, and after your hospital stay. Physical therapy is going to show you what exercises you can do before and after surgery. If you have time to do these exercises, it's really important to do them. Patients that have done these exercises say they really help strengthen those muscles that you're going to be needing after surgery. And you might say to yourself, well, how am I going to do any exercises? I can barely walk. What's so great about these exercises is that you don't have to go out and start a gym program. You can do these exercises sitting in your living room, watching TV, or laying in bed. They're not a lot of motion exercises, but they are really helpful. Okay, so one of them is called an armchair push-up. And you might say to yourself, what do my arms have anything to do with my hip or my knee replacement? You are not going to believe how much pressure you're going to be putting on your arms getting up and using that walker. You can put as much pressure on your hip or your knee as you want to, but it's going to hurt, so you're not going to want to. So you're going to want to push through those arms to help take off some of that pressure for your leg. So doing a simple exercise, just raising your fanny off the chair, even if it's a little, is going to help strengthen those arms. Who you can contact if you have any questions is myself. All right. Pre-hospital plan, you do need to get a physical exam of some type before you come in for surgery. Some of you will go to your primary care doctor to get this exam. Many of you are going to go to the peak APRN to have that exam. You should try to do it as far out from surgery as possible, because let's say they find something on your exam that you need to get further investigated or you need to get corrected. Let's say you have high blood pressure or you have an irregular heart rhythm, something that needs to be looked into further. Maybe your lab work is off. You would want to have that time to do that. Most of you are going to need to get an EKG. You will find out if you do need to get that EKG, and someone will tell you that, and you can have that done at one of the outpatient centers, or if you're having your peak appointment, they'll do it at the peak appointment, but you do need to get that EKG done before surgery. If you have a specialist, such as a cardiologist, pulmonologist, endocrinologist, you may or may not have to see them before you come in for surgery, depending on when the last time you saw them, what your current medical condition is. You will know after you see the peak APRN, or if you're seeing your primary, whether you do need to be cleared by your specialist. Seeing your dentist. We have that up here because many patients will say, why did I need to go to the dentist? What do my teeth have anything to do with my hip or my knee replacement? Well, over the past few years, they have linked dental disease or dental problems with things like heart disease or infections in the body. So we want to make sure that you're in the best possible medical condition that you can be in before you come in for surgery. Let's say you haven't gone to the dentist in a lot of years, and you might have an underlying infection that you don't even know about. So you go through the surgery, you didn't go to the dentist, and that infection seeds in your new joint. That would not be good. So that is why we made sure that you are cleared by your dentist and you don't have anything wrong that's going to prevent you from being healthy. And no dental work, none, within 2 weeks of your surgery. That is including a cleaning, okay? Because if you think about it, they're scraping bacteria from your teeth, your gums are bleeding. If that bacteria gets into your bloodstream, that could seed in your new joint. So no dental work. And there is a period of time you need to wait to go back to the dentist after your surgery, but that is surgeon dependent. So depending on your surgeon, and when you go for your follow-up appointment with your surgeon, you can ask that question. When can I go back to the dentist? Most of the surgeons, it's at least 3 months after surgery. So if you have a dental appointment a month after surgery, you should probably change that. But find out from your surgeon how long they want you to wait after, okay? And when I talk about seeing your dentist, you know, no dental work within 2 weeks of your surgery. If a week before your surgery you have a terrible toothache, go to the dentist, because you want to make sure that nothing is going on. you would want to see your dentist, and then if something bad is happening, you'd want to postpone your surgery. But you'd always call your surgeon to tell your surgeon what is going on. Visit the lab in the hospital or the outpatient center. Right at this moment, the hospital lab is not open, but you can always call to find out because things change on a daily basis with the COVID. So you can find that out. But all the outpatient centers, Saybrook Road, the Shoreline Clinic, there's one in Marlboro, you can have your lab work done. Now, certainly, if your insurance company will only pay for you to go to Quest or another lab to get your lab work done, you're not going to come to one of our labs because you don't want to have to pay out of pocket for that. But if your insurance company doesn't make you go to a certain lab, if you can have it done in one of our outpatient centers, it does make getting your lab work results back easier. Nose swab. When you come in for blood work, someone is going to swab your nose, like this picture. They are not testing you for COVID. At this time, we are testing all patients for COVID, but that's not what this picture has to do with. But you will get a phone call. Usually they're doing it 3 days before surgery, and then you are quarantined until your surgery date. So just realize that that's probably what's going to happen. And if there's going to be a change, we will tell you that. But right now, that's what they're doing. They're swabbing all of patients for COVID. But what this picture is depicting, and this is something we've been doing for a few years, what they are looking for is staph bacteria. Believe it or not, there's a lot of people with staph bacteria in their nose. It's called colonized. Colonized means that it's living in your nose, but it's not causing you a problem because you're healthy. But if that staph bacteria gets from your nose into your new joint, that would be a staph infection, and that's a bad infection. So what they do is they put that Q-tip in your nose, and then they take a Petri dish. You probably remember the Petri dish from biology class, and then they rub the Q-tip across the Petri dish. And what they're looking for the next couple of days is to see if that staph bacteria grows. Okay, there is a strain of staph bacteria called MRSA or MRSA. So they're looking for regular staph, and they're looking for that strain of staph bacteria called MRSA. If you are positive for either of these, you will get a phone call only if you're positive, and they will tell you exactly what you need to do. If you are positive, you have to get a cream. It's a prescription that you're going to put on a Q-tip and put it in your nose a couple of times a day for a certain period of time to kill that bacteria. If you are positive for that strain of staph bacteria called MRSA, you will get treated, but when you come to the hospital, everyone is going to need to wear gowns and gloves when they come in your room. And that is because it is a more antibiotic-resistant staph bacteria. And our hospital policy is you have to have 3 negative cultures. And a culture is when they put that Q-tip in your nose, and they rub it across the Petri dish, and it has to not grow 3 times in order for us to deem you free from it, okay? So what does that mean to you? That means that if you are positive for MRSA, you're going to get treated for it. When you you come to the hospital, everyone wears gowns and gloves in your room. When you leave the hospital, you can always go back to your primary care doctor to get the script to go back to the lab those 3 times to get tested. Because if you don't do that, which you don't have to, if you're ever hospitalized again, that kind of follows you, and everyone would have to wear gowns and gloves when they're back in your room again, okay, when you're back in the hospital. And there is a period of time you need to wait to get tested between tests and after treatment. That's why you usually don't have time to do all of that before you come in for surgery, okay? Preventing infections. So we want you to wash your body. Everybody has bacteria on their body. We want you to wash your body a certain way for the 3 days before and the morning of surgery. Okay, one thing I do want to tell you, after this program, I am going to be sending out a evaluation of the class and a little quiz. It's a very short quiz. It's pretty easy. So please, if you wouldn't mind filling that out, it's going to be something called SurveyMonkey. I would really appreciate that. So I'll send it to your email, and then if you could fill it out, that just helps me to make sure that I spoke correctly and everyone could understand me. So thanks in advance for that. So we want you to do this wash for the 3 days before and the morning of surgery. So let's say your surgery is on a Monday. You're going to do this wash on Friday, Saturday, Sunday, and then Monday morning. If your surgery is on a Tuesday, you're going to do it Saturday, Sunday, Monday, and then Tuesday morning. Okay? So you're going to follow the same procedure to wash your body. And I'm going to take it off here and I'm going to demonstrate and then I'll come back to this. Oops, sorry, I just went the other way instead of getting out of here. Okay. So for the 3 days before and the morning of surgery, you're going to follow the same procedure. Now, if you have to be here day of surgery at 5:30 in the morning, you do not have to do that shower first thing in the morning. You can do it the night before. That is fine. Okay. So the first thing you're going to do for the shower is you're going to get yourself a bar of antibacterial soap. Several manufacturers make antibacterial soap. Some are easier to find than others. Dial makes an antibacterial soap. There's one, Safeguard makes an antibacterial soap. There's one called Lifebuoy. So whatever brand of antibacterial soap you want to use is fine. But get yourself a bar of soap. And then you're going to wash from head to toe. Wash everywhere with the antibacterial soap. If you normally use shampoo in your hair, you can use shampoo. You don't have to use the antibacterial soap in your hair. But wash everywhere. Then you're going to do a second wash. When you go to the lab, hopefully if it's one of Middlesex Hospital's labs, you're going to get a bottle of Hibiclens. Now your bottle, you have a picture of it in the PowerPoint. Your bottle may be a different color. I think it's a green or it's a teal color, which is fine. But you're going to do a second wash with that. And you can use your hand to apply it. You can use a sponge to apply it. You can even use a kitchen sponge. Please don't use the one you did your dishes with or washed your counters with. This has to be a brand new sponge, okay? So a sponge, your hand, or a face cloth. Now, you cannot use the face cloth that you washed your body with yesterday, kept it in your shower, and go back to use it today. Because again, bacteria love warm, wet areas. It's going to collect bacteria, okay? So it has to be a clean face cloth every day, or a brand new sponge, or a clean sponge every day. So with the Hibiclens liquid, it does not lather and you don't need a lot of it. So let's say I'm using my hand. I'm going to put a little on and I'm going to do a gentle scrub and a circular motion, okay? And I mean gentle. We had somebody scrub so hard that their surgery had to be postponed. So a gentle scrub and a circular motion from the neck down only. You don't want to get that Hibiclens on your head, hair, and face, and you don't want to rub it directly in your private area because you could get burns, okay? So directly front and back, you don't want to get it in your private area. If you're having this hip replaced, you still want to wash the front, back, and sides. If you're having this knee replaced, you're going to wash the front, back, and sides using an extra amount of time. So you're going to do your whole body except for your head, hair, face, and direct private area, but you're going to spend a little extra time on the hip or the knee you're having the surgery on. Once you are totally done, you're going to leave it on for 1 to 2 minutes, and then you're going to rinse it off. So in essence, you are taking 2 showers in one. During this period of time of the wash, no suntan lotion. You can use it on your face and your arms, but suntan lotion on your legs for those 3 days suntan lotion really coats your skin and you're not going to get that antibacterial property. And try not to be using any kind of moisturizing lotion on your legs because again, that could have bacteria in it and you're putting it back on your body. Okay, use a clean towel every day. If I use a towel today and I hang it up, it's wet, it's going to collect bacteria, and I'm going to stick it back on my body tomorrow. So you don't want to do that. Wear clean clothes every day. If you have a really dirty job, shower the night before, every evening, every night before you go to bed. Change your sheets before you start this whole process. You don't have to change your sheets every day, but change your sheets before you start the process. Okay? So I'm going to go back to your instructions. I'm going to present so that you can see exactly how your instructions read. Okay. So for the 3 days before in the morning of surgery, you're going to take a regular shower using an antibacterial bar soap. That would be like the Dial or the Safeguard. And keep that bar of soap for after the surgery, okay? You are not going to use the HIPAA cleanse after surgery because that's really more for a surgical wash. But you do want to keep that bacteria off your skin, so you're going to use the antibacterial soap after. So make sure you buy one that you like the fragrance of, because you'll be using that until you go back and see your surgeon. So be sure to cleanse your whole body and then rinse off. This is still, we're talking about the bar of soap. Then gently apply the HIPAA Cleanse liquid soap to your skin using a circular motion. Use a clean sponge or your hand to apply. Use a clean long-handled sponge for areas that you cannot reach. If you are having trouble reaching areas right now, you're going to want to get yourself a long-handled sponge. They are not easy to find. I tried to look in a few dollar stores. I looked in Walmart. I could not find a long-handled sponge. You definitely can find it on Amazon. But remember, with COVID, sometimes it takes you a couple of more days to get things. So I would do that beforehand, just to make sure that it comes in before you are going to need to do this wash. Okay, so continuing with the instructions. Wash from the neck down only. This is with the HIPAA cleanse. Avoid getting it in your eyes, ears, head, hair, face, and direct private area. Spend some extra time cleansing the hip or the knee you're having surgery on. Let it stay on for 1 to 2 minutes and then rinse it off. Now this says do not shave your legs the day before or the morning of surgery. The surgeons really don't want you shaving your legs for the week before surgery. And the reason for that is you could get what's called a microabrasion. That's a little cut that doesn't even bleed. But if bacteria gets in there, it could go to your new joint. We don't even shave in the hospital. If you have a really hairy leg, they would clip your hair. They don't shave any longer because of the microabrasions. Remember that they're going to give you the HIPAA Cleanse liquid when you get your blood work done. But let's say you go to Quest, or you went to the lab, or one of our labs, and they forgot to give it to you, or you knocked it over in the shower. You can buy that HIPAA Cleanse liquid soap over the counter at Price Chopper, Stop and Shop, or any drugstore. Okay, you can just go to the pharmacy section and they will be able to help you with that. Nutrition. Try to eat nutritionally before you come to the hospital. The better you are, mind, body, and soul, the better you're going to do during and after surgery. So I'm going to toggle back because I'd like to show you in the book where we talk about nutrition. Okay, so in your book, under the Get Ready tab, which is the second tab, there's a whole section on nutrition. This is called My Plate. Our government has a website, and the website address is right underneath the plate. It's called choosemyplate.gov. Okay, and so this section, our dietitian worked with the website to develop this section. So if you turn the page, it talks about vegetables, fruits, grains, dairy, and protein foods, and how much of that you should be eating for a healthy diet. Then we have a sample menu, and then a sample menu continued. And then there's the old food pyramid that you might have remembered from the past. And under this are important nutrients. Now, these nutrients are important before you come in for surgery and for healing after surgery. So under each of these categories, fiber, calcium, vitamin D, protein, and iron, gives you lists of foods. If you want a more extensive list, go on the website. It'll tell you what more foods to eat that will help in each of these categories. And you might say to yourself, fiber. What does fiber have anything to do with my hip or my knee replacement? You will not believe how much constipation is a problem after surgery. Even if you've not had constipation problems now, it could happen after surgery. Having opioids and less activity can really cause constipation. So fiber is going to be really important. But fiber by itself actually bulks your stool. Fiber plus fluid is what's important. So we are going to want you to drink 6 to 8 8-ounce glasses of water every day. I can hear some of you groaning out there that you hate water. So think about that now and start flavoring your water. What would make the water taste best for you? maybe put an orange slice in it, or maybe cucumber slice, or other types of fruit. Those types of things will definitely help flavor your water. Maybe you like Crystal Light. The only thing I caution you on is if you like maybe iced tea and you're thinking, oh, I can drink like a couple of gallons of iced tea every day. If it's got caffeine in it, it's really counterproductive, or it's not working well for you, because what happens is when you're drinking a lot of caffeine, it pulls the fluid from your body. So you want to really try to avoid that. Should you stop drinking coffee or tea in the morning? No. Or if you have a soda in the morning, you're not going to want to stop totally your caffeine intake, because you truly will get a headache. So you don't want to do that. But do you want to drink 2 liters of soda during the day that has caffeine in it, or a gallon of iced tea, or 5 pots of coffee? No, you don't want to do that. Try to cut down on that, because like I said, that will pull the fluid from your body, and that's not good. So you want to make sure that you're drinking 6 to 8 8-ounce glasses of water and having the fiber, because that will help you go. Another thing you might want to do is stock your house with prune juice. Patients have said prune and apple juice mixed together and warmed. For some reason, the warming helps. Or prune and ginger ale. I don't know why someone tried that, but they said it worked really well, but they had to warm that too. Someone else said warmed applesauce. So those are just some tricks that you can do. Back to the book for a minute. Actually, the next page talks about diabetic eating. So your plate is, if you're diabetic, your plate is going to look different than someone that's not diabetic. So here's a sample menu for diabetics. And then if we turn the page one more time, we actually have classes here at the hospital for nutritional eating for diabetes. If you are interested in these classes or trying to go to a class, there's a phone number on here. Call them. You might say to yourself, I'm not going anywhere because of this COVID, and I totally understand. I think they're doing like telehealth classes. So you could be in the comfort of your own home and learn about eating and actually talk to a diabetes educator. So if you call the number, they will get the referral from your doctor, and then you can take the little class. But just try to eat as nutritionally as you can. For those of you that have Dr. Reardon and you're taking the whey protein, keep doing that after the surgery too. So if you have some left, that's really great. If you don't have Dr. Reardon, you can eat foods with protein. That would be like lean meats, chicken, fish. Beans are a really good source of protein, eggs, peanut butter. So there's ways that you can get it through your diet too. Okay, so let's see what's next. Okay, let's talk about some hand hygiene. I'm going to go back to presenting so we can see what. Okay. Oops, I don't know why that did that. Present. I think I hit the wrong button, sorry. Right. Okay, hand hygiene. Especially now with COVID, hand hygiene is the #1 prevention of infection, besides wearing your mask. And that's going to be really important too. So everyone should be washing their hands. We made this slide for the flu, but this slide is important now today too. So it's the #1 prevention of infection. Everyone, staff, visitors, and you should wash your hands. If using soap and water, 15 seconds. Or you can be using Purell. You can bring it in your own little bottle of Purell or hand sanitizer or antibacterial cloths. But speak up. If you feel someone is coming in your room and they're touching things and then they go to touch you, say something. You don't want to have a chance of having an infection. Okay, pre-surgical testing. Now, I'm sure all of you have gotten the phone call already where they wanted to know your medical history, any allergies you've had, any, your list of medications, what pharmacy you use. anesthesia-related problems, you will get a phone call the day before surgery just to verify everything and tell you what time, if the time has changed. But they always call you the day before to make sure. They have up to 24 hours to be able to change your time of surgery. So just be prepared that you may have a different time and they will call you the day before. So some important things on this slide: medications. What constitutes medications, or what are medications? Now, this is one of those questions on that quiz. So what is a medication? A medication is a prescription that you have. Could be an eye drop, could be an inhaler, could be something that you bought over the counter. Like what? Advil, Motrin, ibuprofen, or Aleve, Tylenol, herbal supplements, believe it or not, or vitamins, vitamin E, vitamin C, all of those are considered medications. Maybe you get a shot once a month or once a week, all of those. Maybe you use a patch, like a menthol patch or a lidoderm patch. They are also included in medications. Maybe you use a cream like Aspra cream, or you use a capsaicin cream. It's a medication. Because everything that I mentioned has side effects, okay? And your surgeon may want you to stop taking that or stop using that before you come in for surgery because of the side effects. So let me give you an example. Vitamin E, Advil, Motrin, ibuprofen, and Aleve, and fish oil. Those all thin your blood. So your surgeon may want you to stop taking that before you come in for surgery because they may not want your blood any thinner. That's why it's important to list everything, okay? Even if you don't think it's important. Even a multivitamin can contain vitamin E. So that's why they make sure that you list everything. And it's really important for you to have an updated list of medications. And I would suggest that you bring that updated list with you, okay? So that when the pre-op nurse is going over your medications, we have everything correct, such as your dosage, such as the type of medication and when you use it. Maybe during the time that you gave the list of medications and now there's been a change, but the dose has changed, or maybe you're taking something every other day instead of every day. So we would need to know what that change is. And you're not going to know if we have things correct unless you have that list. Another time you might want to bring out that list is the day after surgery. If you're still here and the nurse is giving you your medications, then you can bring out that list just to make sure that we have everything correctly. Okay? So a good idea, always be an advocate for yourself. And do not bring in your own medications. We don't want you taking your own medications and us giving you medications at the same time. So please don't take your own bring in your own medications. A lot of times there's two names to a medication. There's a brand name and then there's a generic name, okay? Usually we as nurses know the brand name or the easier name. You as patients usually know the generic name. So we may be talking about the same medication, but you may not know that because we are using the brand name and you might be thinking of it as the trade name. For instance, there is a water pill, some people call it a water pill, which is called Lasix, which is also called furosemide. So we may say, we're giving you your Lasix pill. You might be confused thinking, oh, that must be a pill they're giving me that just in the hospital. They forgot to give me my water pill, so I'm going to take my furosemide. You would not want to do that. You could make your blood pressure too low. If it was a heart medication, you could change the rhythm of your heart. If it's an opioid or a medication that helps you relax, you might have too much of it. So we don't want you taking your own medications. Leave them at home unless somebody tells you to bring it in. The only time that you would bring in your own medication is if we don't have a substitute for it or you can't take a substitute, okay? And then somebody will let you know about it. Okay, this is what you're going to want to bring to the hospital. Less is better. You know, with COVID, you're going to a floor that has no COVID patients, but you still want it. You're coming into the hospital, so you just want to bring as little as possible. So you want to bring your insurance card, a picture ID, copy of your living will. If you have one and you tell us you have one, we would like to have a copy. Personal toiletries, I mean, you don't really need to bring in anything. If you want to bring in deodorant, that's fine. We don't have that. But we do have toothbrushes and toothpaste, so you can leave yours at home. Loose fitting clothing. What you wear into the hospital, you can wear after the hospital. So I would suggest sweatpants or shorts, and you want a short sleeve shirt because you're going to be getting a IV or an intravenous line, a little catheter that goes in your hand or your arm, and we want to be able to get to that. So if you have your sleeves are too long or they're too tight, that's going to be hard for us to do. And you will be getting dressed. Usually it's the day after surgery, unless you're leaving the same day, and then you'll get dressed that day. Occupational therapy is going to come in. Occupational therapy deals with helping you with eating, dressing, bathing. You're not going to have any trouble eating, but you may have trouble dressing and you may have trouble bathing. So they are going to come see how well you can accomplish those things. And if you need adaptive equipment to help you while you're healing from your hip or your knee, they will give you that equipment. So they're going to want you to get dressed. It is important for you to bring in a good pair of shoes. Or if you have sandals that have a back to them, that's fine. You really don't want to be wearing flip-flops, and you don't want to be wearing, the kind of sandals that don't have a back, because those are not going to be easy for you to walk in. And you don't want to have an accident, you don't want to fall because your shoes are falling off of your feet. Plus, it's a good idea to be practicing with the shoes with a back because you will probably be wearing shoes like that, and that's you're practicing with the occupational therapist, okay? So dentures and adhesive, if you have dentures, if you wear glasses, bring those. If you wear hearing aids, please bring those, extra batteries and the case. If you have CPAP, now this says bring your machine, mask, tubing, and settings, but right now we are using our own machines just because of COVID. So for right now, don't bring in your machine. It would be good if you knew your settings, but we will use our machine here. What to leave at home? Jewelry or valuable items. Really try to take everything off if you can. Wallets, credit cards, cash. If you have a copay the day of surgery, certainly you can bring in the payment and then send the everything back with whoever came with you. Oh, and whatever you bring with you the day that you come in the hospital, if it's at all possible to have whoever comes with you take that back to the car, or if you leave it in the car and then have them bring it upstairs once you get up to the floor, that is a good idea. They don't have a lot of storage in the pre-op area, so you're better off just leaving everything and having somebody bring it up later. Please check with our visitor policy when you're coming in, because it changes, and it's changed from no visitors. Right now you can have one visitor, but you might want to check the policy when you come in because it may change again, and you'd want to know that information. But back to this, no cigarettes, matches, lighters, no hair dryers, curling irons. Don't bring any medications unless you're told to do that. You want to make sure that if you bring in a phone and your phone cord, that you go home with both of those. So just try to keep a thought in your mind of what you're bringing in so that you can bring it home with you when you leave. Pre-operative preparation. So the day of surgery, you're going to come to the main lobby of the hospital. The front doors do not open till 5:30 in the morning. That is like international clock time. So if you have a cell phone, it would be your cell phone time. Okay, so if your watch says that it's 5:30, but your phone says that it's 5:20, those doors are not going to automatically open. So don't get there any earlier than 5:30 the day of surgery. Okay, right now you're going to go in and you're going to go to the information desk, and they'll tell you exactly where you need to go. So straight in the main lobby. Where you're going to go for surgery is on the ground floor. So when you go to the ground floor, you're going to come out and they'll tell you exactly what to do. But they're going to have you come in the back. You are going to do one last wash. You don't have to get into a shower, but they're going to give you a packet of warm cloths, and they're going to tell you exactly what you need to do to wash your body before you come in. They are going to take a Q-tip with an iodine solution and put it into each of your nostrils. It's not for COVID. We were doing this before. And even if you were negative for the staph or that strain of staph bacteria called MRSA, they're going to do that because they just want to do one last swipe, make sure everything is killed before you go in. They're going to start your IV, and then they're going to do a timeout procedure. They're going to go over your name, your date of birth, who your surgeon is, what surgery you're having done, and which leg, and then they're going to mark it. So if it's this knee, they might put their initial there, and they might put an X there. If it's this hip, they might put their initial there and an X there, so that you know that the correct surgeon is doing the correct surgery on the correct patient on the correct leg. Okay. And also, you are probably going to be asked about 900 times what your name and date of birth is. Please don't be offended by that. We are asking you that because we want to make sure that we have the correct person. And you might say to yourself, okay, but why does the dietary people, the people from the kitchen, need to know what my name and date of birth is? Because let's say there's two people on the floor with the exact same name. Now, that is unusual to have the same first and last name, but it is not unusual to have the same first name, nor sound alike last name. So if somebody comes in and they're talking fast and they say John Smith and you are John Smythe, it may sound like Smith. And so you may say yes. And if they don't do your date of birth and you have an allergy and they give you the wrong tray, that would not be good. So we want to make sure that you are getting, that we're taking care of you correctly. So please don't be offended by that. Special equipment, intravenous, that's a little catheter that either goes into your hand or your arm. It's going to deliver fluids. We usually do 3 doses or 24 hours worth of antibiotics. Pain medication you may be getting through that IV. We usually have it from the time of surgery till you're eating and drinking good, and then we take that away. Oxygen, that's a little tube that goes in your nose. It's going to give you oxygen from the time of surgery till the next day, and then we have a little machine that we put on your finger, and when your oxygen level is good, we take that away. Dressings, different surgeons use different dressings or coverings over your incision. So I'm not going to get into the different types of dressings right now, because when you're here, it'll be too confusing. When you're here, we're going to tell you what dressing you have on, how to care for your incision, what to do after, when you can shower, all of that. Now, splint or abductor pillow, there's 2 ways for a surgeon to approach and replace a hip. There is the anterior lateral approach, which is more towards the front, and then there's a posterior approach, which is towards the back. So depending on your surgeon, on whatever you and your surgeon decide, and that is the type of surgery that they are going to do. So each one of those, there's certain precautions or motions that you can't do for a period of time because you could dislocate your hip if you do those motions. So we will tell you all about those when you're here, and you will understand them before you leave. But with the posterior approach, or if they go to the back to replace your hip, one thing that you can't do for 6 to 8 weeks is cross your legs. So what are you going to do at night when you're sleeping? You probably are going to stay awake just so you wouldn't cross your legs. So we're going to give you either a splint or an abductor pillow. And I'm just going over that now because if you come up from surgery with one of these on, then you know why. So the splint is an apparatus that gets wrapped around your leg and gets Velcroed. And that is to keep your leg straight, making it harder for you to cross your legs. An abductor pillow is a triangle or a wedge that goes between your legs and gets Velcroed around. And that too will help to prevent you from crossing your legs. And you'd only be wearing either of these apparatuses at night, not during the day. You don't have to walk in them. So, and we will explain to you how to use this and how to put it on. Okay. Lung care. We want to prevent any complications from happening after surgery. And I'm going to go back to presenting so I can show you what this is. Okay, so this machine, you're going to get this machine and they're going to give this to you in the pre-op area. So this is called an incentive spirometer. if you look over here, you probably can't see this, but there's 3 ranges. There is best, better, and good, or good, better, and best. So if you think about it, we always want to be the best. So the best range is this little range right where my finger is. Over here, you want to try to get this up as high as you can. And you can use this little yellow piece on the side to set goals for yourself, okay? But using this machine, it's quality over quantity. So even if you can only get it halfway up, but you're keeping this in the best range, that is better for you than going higher and being good. You want to be the best. So the way to use this machine is, first thing you're going to do is get rid of all your air. So you're going to breathe out. And then you're going to put this in your mouth and you're going to breathe in, because breathing in brings that oxygen all the way to the bottom of your lungs. And you might say, why would I use this machine? Well, we want to prevent a complication called atelectasis. What is atelectasis? Atelectasis is when your lungs stick together at the bottom. So if you're not doing a deep breathing, that your lungs can stick together at the bottom. And how do we know that? We know that because usually patients will have a fever, okay? So we don't want that to happen to you. So we are you're gonna do this and get that oxygen all the way to the bottom of your lungs to open that up and prevent that from happening. So the secret to this machine is slow and steady, not fast and furious. So first thing I'm gonna do is breathe out. Then I'm gonna put this in my mouth and I'm gonna do a nice, slow, deep breath in, getting it as high as I can. I'm gonna hold it for a few seconds and then I'm gonna blow it out. So blow all your air out. You're gonna hold it for a couple seconds and then you're gonna breathe out. Now, if I went fast and furious, it looks really impressive and it's good for your lungs, but it's not the best. The best is to do it slow and steady, okay? So I'm gonna give you an exercise that you can start doing right now to help get your lungs in the best shape you can. And you can usually tell if someone is doing this exercise because they seem to do that machine better. So this is called smelling the roses and blowing out the candles. So doing this deep breathing exercise, I'm going to use my nose because I want to get all the fragrance. And then I'm going to blow out my birthday candles doing my lips like, because that's how you usually blow out birthday candles. So if I had a bouquet of roses, I'm going to do a nice slow deep breath in, hold it for a couple seconds, and then blow out all my birthday candles. So in. Really feel those lungs expand, hold it for a couple seconds, and then blow out your birthday candles. Smell the roses. Hold it for a few seconds. Blow out your birthday candles. Try to do this several times a day. And when you come in the hospital, we want you to do that like 8 to 10 times an hour, okay? When you're smelling the roses and blowing out the candles, try not to do it a million times in a sitting because you will get dizzy. If you start to get dizzy, you've done it enough, okay? We also, the next slide is going to talk about blood clots. We want to prevent blood clots from happening. When you've had surgery and you're laying in bed, you can get blood clots. And how does that happen? When I'm standing here, my heart is pumping rich blood. It's getting to all the cells in my feet and my legs by gravity. I'm standing here, it's going down. My cells will use that. There's a waste product. The used blood needs to get pumped back up to my heart. How does it do that? It does that for me and you by your walking and my walking motion. So this walking motion is pumping that used blood back up to my heart to get recirculated and refreshed. So if I've had surgery and I'm laying in bed, that exchange is not happening easily. The blood can pool in your legs and you can get a blood clot. So the first thing you can do after surgery, and this is one of those exercises that the therapist is going to show you, is called an ankle pump, okay? Simple exercise. You can pump your toes to your nose, to the floor, nose to the floor. You want to do good ones. You want to feel that pull in the back of your leg. Okay? So you can do that right after surgery, after, the spinal anesthesia wears off. You can do that. It's like pumping the gas pedal, but that will help pump the used blood back up to your heart. You're also going to come up to the floor with either foot pumps or leg wraps on. A foot pump goes on your foot, a leg wrap goes around your leg. It squeezes, releases, pumping that used blood back up to your heart. Okay, so be an advocate for yourself. You're going to a wonderful floor. The orthopedic unit has orthopedic trained nurses, patient care technicians, physical therapists. Everybody is trained in orthopedics, or for caring for people with hip and knee replacements, shoulder replacements, all of that. But sometimes you forget. Sometimes you put the foot pumps or leg wraps on the patient and you forget to turn it on. Or you meant to put them on and you forget. So you should be wearing those when you're laying in bed or sitting in the chair. So just remind someone, where are my ankle pumps or leg wraps? Okay, so the next thing, catch up and see if I need to go back to the presenting or, okay. All right, let's go back to present. I just have to catch up for a second. Right. Okay, you're also all going to be on a medication to prevent blood clots. All of these listed here, aspirin, Coumadin, Xarelto, Fragmin, Arixtra, and Lovenox, are all indicated, and they're all for your types of surgeries. But all of the surgeons are using a baby aspirin twice a day to thin your blood. Okay, so if you're already on a blood thinner, let's say you're already on Xarelto, or you're on Eliquis, or you're on Pradaxa, you're going to go back on that. Or let's say you had a blood clot in the past, or you can't take aspirin for some reason, or you have a condition that predisposes you to blood clots, then you would be on something else besides aspirin. Usually you're only on Coumadin if you were already on it. Xarelto is a pill. Fragmin, Arixtra, we hardly use those. Lovenox is the injectable, if you would need that. So you'll know exactly what medication you're going to be on and how often to use it, and given all of that information before you leave the hospital. Pain management. We do what's called multimodal pain management. And you might say to yourself, what the heck does that mean? And I'm going to go back to presenting. Okay, so when you've had surgery, your body's reaction to that surgery is to send fluid in the area. Your body doesn't realize that you had the surgery on purpose, so it wants to fix the injury that it's had, even though you did it on purpose. So it's going to send fluid in the area. Fluid causes swelling, okay? And think about this. If you have a lot of swelling in your hip, your leg's going to feel like 1,000,000 pounds. If you have a lot of swelling in your knee, you're not going to be able to get much motion out of that because your knee is going to be so big. So we want to prevent or try to limit the amount of swelling that you're going to have. So it's going to be really important for you to ice and elevate when you go home. You might think, I just got my new hip or my knee. I want to use it as much as possible. And I totally understand that. But for the first 2 weeks is the time where you usually have the biggest swelling time. So if you think about it, if you're up, down, up, down, up, down, up, down the first day, by the end of the day, you might be really swollen. And now it's going to take you days to get that swelling down. So you don't want to do that. Okay. So you're going to want to keep your legs up more than you keep them down. But think about every hour getting up and walking around for 5 to 10 minutes. Because A, you don't want to get stiff for sitting too long a period of time. And you want to help prevent blood clotting by walking around. So it's going to be important to be doing both of those things. And this is why one of these classes is so important, because you want to make sure that you plan for when you go home. You don't want to get home and say, geez, I'm not sure where I'm going to sit. I don't have a good seat to be able to put my leg up so that I can help with the swelling. So think about it. If you've always wanted a recliner, this is a great time to get a recliner. This is not a recliner, but I'm going to show you. So think about what type of recliner. You don't want one that's really low if you're tall, or one that's really high if you're short to sit in, because you want to be able to get in and out of that recliner. Think about where is the handle. So if you don't get an electronic recliner, how are you going to be able to put the legs up? So if you had your hip replaced over here or your knee, is that going to be bothersome to try to get the lever? Is the lever way down here? Is it up here? So these are things to, when you're going to check one out, practice that, okay? Another thing to think about is when your legs are up, if you had your hip or your knee replaced, are you going to be able to close that recliner, okay? Because you may not be able to do it one leg. So think about that. Another thing I would have you practice, because you might say to yourself, well, I have a recliner in my couch. I have 2 of them. But can you get up from that really easily? So think about that. And I would have you practice. This is the things that you're going to want to prepare your house and practice in your house. So let's say I'm having this knee or this hip replaced. Try getting in and out of the seat without using that leg. You don't have to hold the leg up so your foot isn't on the ground, because you are going to be able to put as much weight. But if you have any swelling, you're not going to be able to bend your leg down here to be able to get up and down. So think about it as keeping your leg up and then pushing off the chair, whether you're having your hip or your knee done. And see if that you can do that. Same with your toilet seats. If you have really low toilet seats, think about that, because you may want to either invest in getting a commode to put over that toilet or a raised toilet seat, depending on how high. I got a phone call this week of someone that said, which one should I get? I have lower toilets, but I'm worried about getting on and off the toilet. So that's why it's really good to practice. And especially if you're not sure what type of hip replacement you're having and they go through the back, one of the other precautions is you can't bend more than 90 degrees. So you can't sit on a really low toilet seat. And when you get up, you're going to have to get straight up. You're not going to be able to bend over to get up. So these are things to think about. But even if you're having the anterior approach or you're having your knee replaced, it may be hard to get off of your toilet, on and off of your toilet. So practice that stuff. You know, maybe you have like an armchair in your house and you're thinking, that's what I'll do. I'll just get an armchair and an ottoman. But think about it. Do you want to spend hours in a chair like this? It's probably not going to be that comfortable. So think about that. One suggestion that I have for you is this is a dense foam cushion, and this came from Joann Fabrics. Whether they're open or not, I don't know. But you can get a dense foam cushion off the internet from Amazon. And why would you want that? So if I'm sitting here, you can see lower. If I put this dense foam cushion on my chair, look how much higher I am. So just a regular cushion, if it wasn't dense, you'd probably squish down. So really is it giving you a benefit? So a dense foam cushion will be easier for you to be higher. So you may have a really good seat in your house, but you sink way down. So you might be able to put a cushion on that to help you out. Another thing that you can do with the cushion is to get your legs elevated. So if I have this cushion, I'm elevating my legs. Okay, so that might be something that you want to do with the cushion. You might want to get 2 of them. You might want to put one in the trunk of your car. I know COVID is here. You're probably not going to do much visiting, but let's say you went to someone's house or you were at a picnic and all they had was low seating. You can put a pillowcase around that so you can clean the pillowcase and you can use that to boost yourself up. And that's something you can stick in your trunk and bring with you. So that's something to think about too. If you are having your knee replaced, we do not want your knee in a bent position for a long period of time. Why? Because what happens is, let's say you say, oh, I have a Craftmatic bed. I can get my legs up when I'm in bed like this. Okay, well, your legs are up. But if you had this knee replaced and you're in this position for a long period of time, it will start to heal that way. And then when you're going to try to straighten your leg, you're going to have trouble doing that. So you don't want to do that. You want to be able to straighten your leg, so straighten so you can walk normally, as well as doing a bending exercise. So one thing you're not going to want to do is you don't want to be sitting in front of a computer for hours or watching TV with your legs down, because the same thing will happen. Now, the first 2 to 3 months are your biggest healing time. So that is the time where you need to be able to straighten as well as doing a bending exercise. Okay, so that's really important. Okay, so elevation is going to be important. Remember, you're going to want to keep your legs up more than you keep them down, but every hour you're going to want to get up, walk around for 5 to 10 minutes. Another thing you're going to want to do is ice. Ice is going to be your friend. So you're going to want to use it as much as possible. 20 minutes on any area. So if your doctor is recommending you use an ice machine, that's fine. Follow the manufacturer's directions on that. But if you're using a bag of ice or a bag of frozen vegetables, and make sure you're planning for that too. You don't want just one bag of ice because you're going to have to refreeze it. So you want to have at least a few of them on hand so that you can exchange them. Okay, so think about that before you come in. All right, so we talked about that. Now, other things that they use. So most of you are going to have spinal anesthesia. That means you're going to be numb from the waist down. If you're having your knee replaced, the surgeon, some anesthesiologists actually will use a short-acting nerve block. Okay, they don't use it for hips because it wouldn't work for you. Now, all the surgeons are using something called Exparil. What they do is before they close up your incision, they inject in the tissue around your hip or your knee. They're balls of solution that sit in the tissue and slowly dissolve. And that will help with the pain. That takes about 8 to 10 hours to actually start working and can last 2 to 3 days. I don't want anyone to get the impression that this is not a painful procedure, because it is painful. You're having a major surgery, but we want to make this as tolerable as possible. Okay, so with the spinal anesthesia, you shouldn't be feeling anything, and that'll be through the surgery. And depending on the person and how the medication works, it may wear off right after the surgery, or it may last a few hours. We can't predict that. So as soon as you start feeling something, it's really important for any kind of pain that you're feeling to let the nurses know so they can come and evaluate you and see if there's anything that you need at that time. What you don't want is you don't want your pain to get out of control, because pain that gets out of control is a lot harder to get back under control. It's going to take time, it's going to take medications, and you're going to be miserable. So you really don't want to do that. All right. The second time you're probably going to get an increase in pain, you're actually going to be home. And so a couple of days later, you may get an increase in pain. So one thing that we're going to do here, and then we're going to suggest that you do at home, is to take Tylenol around the clock, as long as you are able to take Tylenol. So if they prescribe that for you, we will have you do that. We give you, as long as you can have an IV Tylenol in the hospital, and then we'd like you to take that when you go home. Or it's called acetaminophen is the generic name for it. So, but you'll get all of that in writing before you leave. We also use opioids. We use anti-inflammatory medication, Meloxicam they use, or Celebrex. So we use different types of medications in order to help you with your pain. Now, some of you will get a muscle relaxer. Now, a muscle relaxer and an opioid, you never want to take together, okay? Because it can make you too sleepy, and that is not what you want, okay? So do not take both of those together. Can you take one a few hours later? Yes, but you just don't want to take them together. And because we're giving you pain medication, less activity, bowels are a big problem. We already kind of talked about that. You're going to be getting stool softeners a couple of times a day. We use what's called Marilax, which are crystals that dissolve in your water, your coffee, any type of drink, and it's pretty tasteless. We will do that to help you out. But remember the prune juice. So the next slide talks about rest and healing. We have earplugs, we have headsets, music channels. It says quiet afternoon rest, but like I said, most patients are leaving the day of surgery or the next day. If you're leaving the day after surgery, please have a ride ready by noon, okay? You might be leaving earlier, and most patients are ready to leave feel ready to leave in the morning, but you have to meet some goals before you leave. We have to make sure that you can do stairs with physical therapy. You have to be seen by the medical doctor, by the physician assistant. We have to send all your prescriptions over to your pharmacy, all of that. So you do have to meet those goals first, but usually you can be out of here by 11 or 12, so it's important to have your ride ready by then. Right now, our visiting hours are 10 in the morning till 8 o'clock at night. Okay, the next slide talks about room service. Right now, you will get a menu. They'll either call you or they'll have you call, but they will explain that when you come in. We'll explain about the food service and how that works. After discharge, lifetime precautions, could be lifetime precautions to protect your hip or your knee. You do need to take an antibiotic before going to the dentist. And remember, there is a certain period of time you need to wait to go back to the dentist. So that is something that your surgeon will talk to you about at your follow-up. You can ask that question to get that prescription for the antibiotic. So that would be before you go to the dentist. Even for a cleaning, you would need to take that. Sometimes for minor surgery or some tests such as a colonoscopy, endoscopy, whoever's doing the procedure, you tell them that you had your hip or knee replaced, they will tell you whether you need to take it or not. Ask your surgeon if the type of metal in your implant is safe for an MRI. Usually it is safe to have an MRI, but you just want to know that. So it's a simple question just to ask and then you'll know. You don't want to be worrying about that later, especially if your surgeon, maybe you don't need one for 30 years down the road, somebody wants to give you an MRI and you don't know whether you can have one or not. Intimacy, for a total knee replacement, there's no restrictions. For a total hip replacement, because of the hip precautions, that's a question you can ask your surgeon. Usually it's about 6 to 8 weeks after. So case management, home versus rehab. There really is no place like home. If it's at all possible for you to go home, you really should. Especially with this COVID, you don't want to go to a skilled nursing facility. It's important for you to have somebody at home with you, especially for the first couple of days. And that's not to get you up and down. That is more for helping with your meals, helping you with water, remembering to take your medications, that type of stuff. It's not to get you up from the chair. If you physically need to have help, then you would have to go to a rehab facility. So just try to find somebody that can come at least for the first 3 days. Transportation, you're going to need to get a ride from here. You don't want to get picked up in a really low car or really high car. You want to get picked up in something that's easy to get in and out of. And then equipment. And I'm going to have the physical therapist is going to come and talk to you after me. And I'm going to have her talk about the type of equipment that you will need. I think that's it for me, except for 2 more things. So near the end of your information in your packet, there's a list of used and donated equipment. Right now, I don't think you can really get any equipment from any of these places because of COVID. But you can get equipment on Amazon. You can go to any of the pharmacies. You can get it at Walmart. So these are things to think about. With a prescription, usually the copay is the same amount as the copay for the prescription as you buying the equipment. So don't make yourself crazy about trying to find the prescription and getting that for yourself. Okay, one last thing that I want to talk about, this last paper. We have partnered with Nutmeg Pharmacy, and it's just Nutmeg Pharmacy because they have partnered with us. But you can actually use Nutmeg Pharmacy after your surgery. What they do is they pre-package your medications. It would be only the medications that you would be taking after your surgery. So for instance, the Tylenol around the clock, your bowel pill, the Meloxicam, if you were going to be taking that. We send you home with vitamin C twice a day. We do something called Protonics, which is going to protect your stomach because you're taking all this medication, whatever you're going to be using as a blood thinner. And they will pre-package that medication so that you don't have to worry about when to take your medication. So the pre-packaging looks like this. They use your insurance and they will deliver this to your house. So you do not have to stop at the pharmacy on your way home. Now, the opioid would be in a separate bottle because that would be something that you would take as needed. So we don't want to prepackage that and just give it to you. So if you look at this prepackaged medication, this is the Protonix or the stomach protector, and that says 7 a.m. And then these medications are 8 a.m. And this is the vitamin C, the aspirin, the Tylenol, and the, vitamin C, and the stool softener. And then they have 3 p.m. and then bedtime, and the medications are in here. Now they have a legend up here, so they list what the medication looks like and what it is. So let's say you've gone through 3 days and you don't need the bowel medication anymore. You would know what to take out because it's right here, okay? So like I said, Nutmeg Pharmacy will use your insurance, and they'll prepackage it, and they'll deliver it to your house. The hospital does not make a profit from this. This is really more for patient satisfaction. I get a lot of questions, calls. It's overwhelming to take all these medications. Now, your own medications that you normally take at home, you would be taking those on your own. These would only be the medications that you would be taking from the hospital. So in this packet is Nutmeg's phone number. So if you do want to use them before you come in, what you're going to do is you are going to call them. There's a phone number down here, and you're going to just pre-register with them. Give them your information. They will tell you whether there's going to be a huge expense, which there shouldn't be because they should be able to use your insurance. And they will look up everything for you. And then we don't do anything until you actually come in the hospital. Your prescriptions get sent to them. You call them on your way home, and they will actually deliver them to your house, which is really nice. So the number is down here. If you could call and register. The surgeons really like this service because then they have rest assured that you're actually taking the medication as directed because it's not in a confusing mess. Okay, so please give them a call and they will be able to set you up with all of that. They can also get equipment for you too. So you can find out how much their equipment is. And if you use that service, they give you a 10% off any equipment that you get from them. Okay, so that's it for me for now. I will be back at the end so that I can entertain any questions, and you can put your questions in the chat box. So now Cheryl from physical therapy is going to come in and do her part. Do you want the slides up?
I'm going to need the slides a little bit.
Sure.
That's what I'm just saying.
Do you want to start with them, or do you want to just use the paper?
I can use the paper if I put it to the side. I just want to try to look for it. I just want to be able to just know what I'm covering.
Okay.
Okay. Thank you.
So I didn't talk about the equipment. I just talked about the paper about the equipment. So if
Okay.
you can do that. I'll just stand over here.
The equipment or,
Like what type of equipment they need.
okay, and there's a special place you want that put in?
Yeah, you can talk about it whenever.
Okay.
Just stay on it.
Hello, I'm Cheryl. I'm one of the physical therapists that works here in the hospital. So we're going to go over initially some information that we need to cover. I'm going to take this off. You can see some information so that you will understand what's going to happen with home care and then also what's going to happen in a hospital after surgery. As far as your discharge to home, our goals is that you should, oh, you already did that part, right?
Yeah.
Did you do that part?
No.
Did you do discharge to home goals?
No.
I'm going to do that. So someone should be staying with you at home. Ideally, that is appropriate, especially the first 1 to 2 days after surgery. You should have somebody there to make sure they're not going to physically help you, but you need to have somebody there for safety. The goals to go home that you should be able to accomplish in order to achieve that is we want you to be able to move safely, be more independent so that that person isn't there to have to actually physically help you. You're going to complete your exercises, complete your stairs, and a good range of motion, and you'll understand your hip precautions. And I'm going to go a little bit over that when we discuss the inpatient hospital stuff. So what are the benefits of going home versus going to a rehab? One thing is when you are in your own home, you're in your own bed, you have all your own walker, your own equipment, and that is often much safer. You feel much more comfortable. It is already adjusted for your height. So that in itself is a very big bonus. Your treatments are one-to-one. And unfortunately, some people think they might get more therapy going to a nursing home, but you may go down to a gym. You will be in a gym with many other patients, and sometimes they'll work a little bit with you, and then they'll work a little bit with somebody else. And so you're not getting a lot of necessarily direct one-on-one time. By having your treatments and therapy at home, that therapist is there only for you. It's going to be direct one-on-one sessions. They're only working with you. All your time is concentrated for you. And you can, if blood work needs to be done, that can be done at home, even though less and less patients are requiring that. The therapy that you will most likely receive is physical therapy, and you will find at home the physical therapist will not be doing just your exercises and your walking, but they're also responsible for checking your wound, checking your blood pressure, monitoring your pain. So there's often never a need for nursing to come in. Some agencies will have a nursing come in if there is any medication issues, but often the physical therapist will be doing that. If you're necessary and you're having issues with your self-care, the occupational therapist is also available to see and work with you on that. And then necessarily if a home health aide is necessary in order to help with skilled dressing or bathing activities. So that is an option also. As far as what will happen when you do go home with your therapist, the therapist is going to set up your goals for you particularly. So again, when you are already home, you could work to those activities and those things you want to accomplish already at home. If you go to a rehab, your goal is first to get home, and then now you're going to have to try to work on those goals. So when you're already in your home, you can work to those things that you need to accomplish right away. And for some people, it can be very difficult. It can be very different from one thing to another, depending upon what they want to accomplish. Therapy at home can last up to about 2 to 4 weeks. And again, it depends upon the patient. When the patient is able to get up and move on their own safely, they're demonstrating safe transfers, they're walking safely, they're progressing, then they often can either complete therapy and then transition to outpatient almost immediately or shortly after. So it really depends upon the patient. But again, we want to make sure that you're safe in your home, and once you're able to demonstrate that safety and you're not homebound anymore, then you can transition to other therapies. When the home care is finished, then you can transition to outpatient, depending upon, often the knees need to go directly to outpatient, but the hips sometimes the doctor will wait till he follows up with him, and then he will recommend some outpatient therapy at that point. As far as equipment at home that we recommend, one of the things that we want to emphasize, yes, you should have a walker, but the walker should be the walker with 2 wheels in the front and no wheels in the back. It can have gliders or the tennis balls or anything like that, but a 4-wheeled walker is not a good choice after surgery because you can't push down and what we call offload, what we're going to talk about. So if that's the type of walker you have, you do want to get a walker with the 2 wheels in the front and no wheels in the back. We also recommend the commode is often helpful in order not necessarily to put right next to your bed, but also to go over the toilet, because a lot of times patients will have difficulty getting up and down from a toilet, particularly if it's a lower toilet, and the commode going over the toilet helps the patients very much in order to safely get up and down. As far as the transfer bench or tub bench, a lot of times we recommend that you wait till your therapist comes into the house, and then they'll make the recommendations, as sometimes depending upon the type of shower you have or how you're set up, you don't want to purchase one in which you might not work in your particular shower. It is also helpful often, especially if you have stairs and as a progression, to have either a straight cane that is adjustable, or crutches are also a good option in order that you may need on the stairs, and they're also a good progression for when you're ready to graduate from your walker. I'm going to go into now the expectations of therapy in the hospital. So we're going to talk a little bit about what you can expect from both physical therapy and occupational therapy in the hospital after surgery. Physical therapy is going to be responsible for your transfers, walking, mobility. Physical therapy can potentially be twice a day. And when I say that, it really depends on what you physically need in order to safely get home and discharge safely. Some patients may only take 1 session. Some patients may need the same day session, the next morning session, but then they're ready to go home after that. Some patients may need an additional session that afternoon. We make this available that you could potentially have 2 sessions because we want you to safely get home, and we want to accomplish your goals so you can get this completed, get your therapy completed, and get home safely. If you don't need the second session, you do not have to have the second session. We want to make sure that you're safe and we achieve your goals. Physical therapy, as I said, will be concentrating on your transfers, walking, stairs. Now, occupational therapy is going to look at your ability for self-care. All of you are having surgery on at least one of your limbs, and that's going to affect your ability for getting yourself dressed or transfers and self-care, either because of the pain or because of precautions that we're going to talk a little bit about, or limitations in your range of motion. You may have challenges with this. So every patient will be evaluated by the occupational therapist. And then depending upon how well you do, they will provide you with some tools in which you can utilize in order to safely complete your tasks, or they also can follow up an additional session if necessary. So again, everybody will be seen by occupational therapy, but occupational therapy will only ever be once a day, where physical therapy could potentially be twice a day if necessary. The next slide talks about after surgery, and it used to say the day after surgery, but we're realizing the sooner we get our patients up moving, the better they do. So the expectation is all patients will be getting up the same day as surgery. Physical therapy will attempt to see you, especially if you have an earlier surgery, to see you in order to get you up that same day of surgery. I know that seems pretty drastic or dramatic, but believe me, most of our patients are very eager to get up and get moving. They're stiff, they've been on their back for a few hours, and they want to usually get to the bathroom. So physical therapy will see you, and you can expect that we'll be getting you up, we'll be going walking. We're going to go over any weight-bearing restrictions or any precautions. All joints are weight bear as tolerated unless you hear otherwise from your physician, which means you can safely put as much weight on that new hip or knee as you can tolerate. But we do expect some pain. So that's why we're going to use that walker, and that's why I've emphasized the walker with the 2 wheels in the front and no wheels in the back, because you're going to want to push through that walker to what we call offload, to take pressure off that joint to make it comfortably to walk. For precautions, the knee joints don't have any specific precautions other than kneeling or twisting, but the hip joints are going to have some precautions on how to safely move. I'm going to go over in more detail that, but that is something that not only are we going to make sure that you understand the precautions, but that you can move safely in order to meet those precautions. And we'll also go over with you some exercises. I'm going to teach you them today, but that you could use that first day we see you. If by chance therapy does not see you that day, either you're not medically ready or you have a late surgery, you will still be getting up with nursing if you are medically stable. And then therapy would see you that next morning. So regardless, you will be getting up moving, and therapy will work on these skills whether we see you that very first day or the next day. A very important slide, this next one, talks about falls. And again, some people are concerned that they might injure their leg by putting weight on it. And I've already told you that that's not a concern, that it actually encourages the weight bearing. But one way you could potentially injure your new joint is by falling. And that's why we can't emphasize enough how important it is that you do not try to get up by yourself after surgery. Tracy has commented to you and told you you're going to be hooked up to different lines. You're going to be on medication that's going to affect how you feel. There's different lines in your arms and your legs, and all of these things can potentially make you at a higher risk of falling. We've seen people who have fallen on knees. We've seen knees open up and incisions. We've seen hips dislocate. You don't want that to happen. We don't want that to happen. So it's very important that you always call for help before you get up. And I don't mean your wife or child or anybody else who's there with you. It should be the nurse, the therapist, or the PCT, your nurse technician. When therapy sees you as getting close to discharge, the physical therapist may clear you to be up walking on your own. And in that case, then you are allowed to get up on your own. But until the therapist clears you, you must call for help. It's very important. The next slide talks about some positioning of your leg. And it's important that you understand what you can do to maximize your success of the surgery. And one thing that we have realized is that sometimes in our efforts, we want our patients to move. The mobility is very important, but in our efforts to, sometimes if people are moving too much, then we overdo, and swelling in your joint can be a roadblock and a potential problem in the progress of your surgery. So it's very important that we want to try to keep your legs elevated, especially those first 2 weeks. The key is how you're going to elevate those legs safely and appropriately. Ideally, you want your legs elevated higher than your heart, so you'd want them up. That can be done very well in a bed or in a recliner chair with pillows. But when you're putting pillows with your knee under your legs, we do not want the pillow underneath the knee like this, okay? You knee patients might find it more comfortable that way, but in actuality, what that happens is it encourages the knee to stay bent, and then we might have a hard time later getting some nice straightening of the knee, which is going to allow you to walk normal. So if you are going to put that pillow underneath the leg, you want to put it lengthwise like this, full length, so that you're not putting the pillow underneath the knee to encourage a bend. So we want the legs elevated, but we also want them straight. Then next, I'm going to talk a little bit about hip precautions. And depending upon your surgeon and depending upon the type of approach or surgery that your physician is going to do, there are different precautions. This first one I'm going to talk about is what we call for posterior hip precautions. And those are for patients, the incision is going to be a little bit further behind in the buttocks region. Okay, and for this particular group of patients, there are 3 general categories of motions that you're going to need to stay away from. The first one is no bending at the hip more than a 90-degree angle. And most patients say, I just had surgery, I'm not bending my hip any more than that. But it's not actually just the bending that's the problem, it's the angle. So what do I mean by that? A problem for these particular patients is you can't bend over to pick something up off the ground because you are breaking that 90-degree angle. So you can see this is a challenge for patients who want to try to put their shoes and socks on or to pick something up off the ground. So you can see where working with the occupational therapist is going to be very important. The other motion with that 90-degree that we want to watch out for is we don't want you to sit on such a low seat that your knee becomes higher than your hip. That is why we encourage the commode to go over the toilet, the cushions to go on the chair to help raise you up. It's going to protect, it'll make it easier to get up and down, but also it protects that angle. The second precaution, no crossing your legs, okay? Some of you may have to wear a splint or an immobilizer, but this is all going to encourage you to not cross your legs. The third one is no rotating your leg in like this. And some people are concerned, well, can I rotate my feet like this? And that's not a problem. The issue becomes when you're pigeon-toed and you turn that whole hip in, that whole hip joint, that's where the issue becomes. So for the posterior hip, the 3 precautions are no bending more than 90, no crossing your legs, no turning your legs in. Now for the anterior hip, this is a different approach. The surgery is going to be a little bit more on the front of the hip. For this particular patient, the main motion we want to watch out is, again, we don't want you to cross your legs, and that's a biggie, but particularly what we call this figure 4 motion, where I'm crossing my legs over, which you kind of see there when you're putting your shoes on. What's happening in here is I'm crossing and I'm rotating my leg outward, okay? This crossing or Indian sitting is a motion that is important that you stay away from. The other main motion that we want you to avoid is actively to kick your leg backwards. Walking is not an issue, but to do an exercise where you actively kick your leg backwards is recommended you stay away. So that's it for our precautions. If you're not sure which surgery you're having, the therapist, when they see you that very first day, they will go over and make sure that you not only understand what your precautions are, but also educate you on how to move appropriately so you can avoid them. We're going to go into some exercises now. And these are exercises that we teach you prior to surgery, but they're the first 3 that I'm going to teach you are the very first exercises we're going to do the first day that we work with you. By teaching you them now, you have a 2-fold benefit. 1, you'll be more familiar with the exercises, so this way when we go to work with you, they'll be familiar, you'll understand and remember them, but also doing them prior to surgery helps to build up the muscles. I'm going to do them with my legs up on a chair here because I want to simulate you doing these exercises in your bed or your couch or your recliner chair. Again, these are not exercises you need to do in a standing position. Okay, the first one is ankle pumps. And this is what you're doing is you're pointing your toes down and bringing them up, okay? Twofold benefit. The first benefit is to prevent swelling from occurring. We talked about that issue of not wanting to have swelling. By pumping your ankles, you help to push some of the fluid up, what we call a muscle pump, to decrease the swelling in your limbs. Another important concern is because you're not on your feet as much, there is a tendency for your feet to drop down like this, and you get tightness in your calf muscles. When you do this exercise, be sure to bring your toes all the way up, and you should feel a nice stretch behind your calf muscles. This gives you a good range of motion in your ankles, so that when you stand up, there's not a tendency to lean backwards. So again, very important, the ankle pumps. The next two are what we call isometric exercise, or exercise with minimal movement. This next one is called a quad set, and it works this big muscle in the front of your thigh. And this is a really important exercise for the knee patients. To do this particular exercise, you're going to tighten your knees, pushing them down. You'll feel your kneecaps kind of go down, and your whole muscles will tighten. You want to hold it for about 3 to 5 seconds, and then you relax. So it's tighten and relax, tighten and relax. The third one is gluteal, or glute squeezes, or works your gluteal muscles. Your gluteal muscles are your butt muscles, and most people say, what do my butt muscles do? Those are your hip extensors that do help you get up and down from a chair. They're going to help you with stairs. To do this particular exercise, you're going to squeeze your butt muscles together. You're going to feel yourself lift up very little bit, hold them for a few seconds, and then relax. So it's tighten and relax, tighten and relax. So the 3 basic exercises are the ankle pumps, quad sets, or what I call thigh squeezes, glute sets, or what I call butt squeezes. By practicing them before surgery, you'll be preparing yourself and getting ready for after surgery. The last exercise is something we call armchair push-ups. And I've talked to you a little bit about that importance of using your upper body to offload. We talked about using the walker, pushing through it to take pressure off the joint that you're having. So many people often will complain after surgery how tired their arms are after surgery, particularly the muscles in the back of your arm. So this is an exercise designed to build up some of that muscle strength to help with your transfers, getting up and down, and also using the walker. In order to do it safely, you want to find a chair similar to this one with armrest, however, not your computer chair with wheels. That's not a good choice. With your feet flat on the ground, you put your hands on the armrest, and you want to try to lift your bottom up off the chair. Now, don't be discouraged if you could only go up a little bit, because even that motion of you just pushing, even if your body isn't able to come all the way up, is working on these muscles in the back, which are your triceps, in order to build up your strength. And believe me, this practice will pay off later after your surgery. The last couple of slides talks about some progression of our sessions. And I've already mentioned that therapy is going to work with you until we get you to the point where you're safe to return home. For some people, that may be 1 session. Some people it might be 2. Some people it might be 3 or more. But again, we will continue to work with you to get you to the point where you need to be able to be safely home. So what are the type of things that we will be progressing or working on? For those patients who are knee patients, we will start working a little bit on your range of motion, because as I said, there's no sense in having a new knee that doesn't bend. So we will be encouraging you to do some exercises to start getting that knee to bend. And I like to even encourage with my patients walking patterns in order to get them walking in a way that's going to encourage the bending of the knee. As far as walking goes, we're going to progress your mobility. And what does that mean? Walking further with less assistance. For some people, it may mean progressing to a different assisted device, such as a cane or crutches. We will progress other exercises as necessary. And for those of you who do have stairs, we will practice them and make sure we do them prior to you going home. But believe me, the stairs are not going to be as hard as you might think. We're going to be doing them in the easiest, safest way possible. And most of you will probably find that the stairs will be very similar to the way that you've been doing them already because your knee hurts. Yes, eventually you will learn to do them normally, but we're going to make sure that you can safely get in and out of your house. But again, we're gonna progress you and get you to the point where you are ready to go home. As far as the last slide, it talks about that it takes about 2 to 3 months. 80 to 90% of that recovery is going to happen that first 2 to 3 months after surgery. So it's very crucial that you be committed and dedicated to your rehab. I tell my patients the surgery is really the easy part because you're just going to lie there for that. The real work begins that first time therapy works with you and you have to get up and get moving. So you have this window of opportunity that you really want to maximize your potential. But do realize that it takes up to a year to fully recover, especially those patients who are returning to higher level jobs or higher level recreational activities. It may take a little bit of time, but that general getting up and being able to move is going to happen that first 2 to 3 months. Thank you.
And now, if anybody has any questions, you can put them in the chat box and we will be glad to answer them. Thank you for coming.
I hate having